Sound check? Perfect. Mackenzie, are we good? Okay. Good morning and welcome to everyone. My name is Nathan Neudorf. I'm the MLA for Lethbridge East, and I'm very happy to welcome you to this very exciting announcement today as a result of our budget 2022. With me is Alberta's Health Minister, Jason Copping. A very warm welcome to you, Minister. There's other special guests here which I will leave to the Minister to announce. Dr. Aaron Lowe, an ICU physician here in Lethbridge and the South Zone Medical Director for Alberta Health Services. We've heard very loudly and rightly from local residents that access to health care is an issue for them. I want residents to know that we're listening. I was excited to listen to the Minister of Finance, Travis Taves, deliver the Budget 2022 less than a week ago. Budget 2022 moves Alberta forward by investing in health care. Training Albertans from primary school to post-secondary creates jobs for the future and continues Alberta's strong fiscal progress over the past 3 years with a forecast surplus of $500 million. It is now my pleasure to turn things over to Minister Copping to share an exciting piece of news from the budget. Minister Copping.
Great. Thank you so much, Nathan. It's a pleasure to be here at the Chinook Regional Hospital here in Lethbridge. It was actually the first hospital as the Minister of Health that I was actually able to tour and see the fantastic work that the healthcare workers are doing here in providing care and service to people of Southern Alberta and to all Albertans. And I'm very pleased to be joined with a number of my colleagues. Again, MLA Neudorf, who've spoken already, MLA Reid from Livingston-Macleod, MLA Scow from Cardston-Siksika, and MLA Hunter from Tabor-Warner. Thank you so much for joining us here today for this wonderful announcement. I also want to thank again AHS and Dr. Lowe for allowing us to be here at this great facility to make this announcement today. And really, this announcement is about, it was as indicated by MLA Neudorf already, it's about what we announced in our Budget 2022 that will add capacity to Alberta's healthcare system. Right off the top, though, I want to thank the frontline healthcare workers who have gone above and beyond the call of duty throughout the pandemic. We are deeply appreciative of their efforts to care for our friends, families, and neighbors over the past 2 very difficult years. Expanding capacity has been at the top of my priority list since becoming the Minister of Health in the midst of the pandemic, so I am very excited about the announcement that I'm making today. Now, while AHS did an outstanding job to expand its bed capacity when it was needed, adding surge capacity in that way, quite frankly, is not sustainable for the future. The pandemic has clearly shown us that we need more permanent beds, more staff, and more resiliency within the health system so that we can be fully prepared for any future health crisis and anything else that COVID may throw at us. As intensive care units quickly filled up during the early part of the pandemic, we quickly learned that Alberta's ratio of ICU beds per 100,000 population was the fewest across the country compared to our provincial peers. So on the ground, AHS was actually surging up from a lower baseline than in other provinces. And this had significant consequences for our health system, as we were forced to reintroduce restrictions in the fall to deal with the 4th wave. And some of those restrictions were with us until Monday evening, and we also had to postpone a number of surgeries to be able to cope during the 4th wave in particular, but also to some degree during the 5th wave. Now, the goal of all the health care measures that we put in place was to reduce the impact of COVID-19 on our healthcare system, in part so that frontline doctors and nurses didn't have to make decisions about which life they were going to save when assigning patients to ICU beds. Now, AHS activated its surge capacity, reassigned staff, and made plans to be able to deal with COVID, and did so successfully. And they also made plans, and we saw this in the 5th wave, for the pandemic response units. Thankfully, only one pandemic response unit located in Edmonton was actually activated during our recent Omicron wave. This response unit was never full, and we were able to deactivate it weeks ago. Meanwhile, the unit in Calgary never had to be activated. Our healthcare system was never overwhelmed because of the healthcare measures, because the Omicron variant was less severe during the 5th wave, because Albertans continue to get vaccinated, and because of the tremendous work of AHS healthcare staff in terms of building the surge capacity. But it did teach us a valuable lesson. Alberta needs more healthcare capacity. We need the flexibility to treat those who come into our medical clinics and hospitals, as well as to respond to surges caused by unforeseen events like COVID-19. Our goal now is to be more in line with our provincial peers, to ensure Albertans have more access to ICU care, no matter what health emergency we may face. So today, I'm very proud to announce that we are investing $300 million over the next 3 years for up to 50 additional, permanent, and fully staffed ICU beds as part of Budget 2022. The $100 million being invested this year and in each of the following 2 years will include the needed staff to keep these new ICU beds operational. The additional ICU beds will be distributed in all 5 AHS zones across the province, and we are currently working with AHS on a plan to determine exactly where the new beds will be located and how they will be put into operation, tracked, and built into our required surge capacity. But I want to tell you, here and now, that Lethbridge will be the focus for any new ICU beds here in the South Zone. Overall, our goal is to ensure maximum flexibility so the system can surge when and where it is needed. And resources can be redeployed to support other parts of the health system when ICU is not facing pressures. We expect these new beds to come online soon in the coming months. And in conjunction with more ICU beds, we are building more health system capacity, resiliency, and sustainability by having the right plans in place to be prepared for the future. We hired Ernst & Young to conduct almost a real-time review of how Alberta and its health system responded to COVID-19 with a focus on capacity, comparing the practices and lesson learned from other health systems across Canada and around the world. Our goal is to ensure that the health system has the appropriate capacity to respond to potential future waves of COVID-19, as well as any additional pressures that may come our way. The resulting Sustainability and Resiliency Action Plan outlines 21 capacity building recommendations across 6 work streams. These include workforce, acute critical care and surgery, primary and community care, governance and decision-making, public health, and modeling. And the plan outlines our approach to ensure resiliency and sustainability of the Alberta healthcare system, with our immediate priorities being on surgical recovery and ICU and acute care baseline capacity. We know that the need to dramatically surge up and on such short notice placed a significant burden on the province's clinical workforce. So AHS will now formalize a new baseline ICU bed capacity plan that includes detailed reporting mechanisms, appropriate workforce planning, and ramp-up strategies and redeployment plans. This will ensure frontline staff are able to support other parts of the health system when ICUs are not facing pressures. A comprehensive review of Alberta's pandemic response is planned for the future. Now, as I conclude, I want to be clear that Alberta's government is going to seize the opportunities for improvement that the pandemic has taught us so far. While the health system has been resilient and healthcare providers have stepped up and gone above and beyond, we know that the system can be strengthened to better manage the strains from the pandemic, and we are taking action to do exactly that through this $100 million investment in ICU beds and by improving our readiness plans in the future. These steps will give Albertans more timely access to the care they need and will build a stronger, more resilient, and robust health system, and will help us to be fully prepared for the next health crisis that comes our way. So thank you, and I now would like to invite Dr. Lowe to say a few words about the benefits of adding more capacity to Alberta's health system. Dr. Lowe.
Minister, I apologize for the noise. This is the sound of progress at the hospital, so thank you for competing with our workers. Throughout the COVID pandemic, AHS has been able to quickly provide the needed hospital capacity both in medical beds and in the ICU. This is a testament to our incredible workforce who have been both resilient and who have worked tirelessly for almost 2 years to maintain our pandemic response. It's also a testament to a system that's fluid and able to evolve to the needs of an ever-changing virus, and we're grateful for that. Healthcare workers are accustomed to dealing with difficult things, and we haven't dealt with anything in recent memory that's been this difficult, and I am so grateful for those who have matched the difficulty with great commitment and care for our patients. In that, I'd like to offer really a heartfelt thank you to all of our awesome workers who have worked so hard during the pandemic, and also a thank you to our patients and their families who have been through a really challenging time this whole pandemic. Other jurisdictions, as the minister mentioned, have not been able to upscale their ICU beds or hospital capacity as efficiently or as quickly as Alberta has. Over the course of the pandemic, we more than doubled our adult ICU beds and during the fourth wave, and we were again able to increase that significantly to meet the demands of the fifth wave. This bed increase meant that every Albertan who needed an ICU bed was able to get one. I personally provided ICU care to many COVID patients and was very grateful that I was never in a situation where a patient needed a bed and we were unable to give one. In most instances, this ability to give patients ICU beds when they needed them saved lives. However, as the minister highlighted, this came at a cost. During the fourth wave, the demands were especially significant, and we had to make difficult decisions about surgery and other procedures that we needed to postpone in order to be able to upscale our ICU capacity and deploy the staff that we would need to support our ICU response. Fortunately, from a provincial perspective, we are now at close to 100% of our normal surgical volume, which is excellent. By adding new ICU beds and staff, we are hopeful that surgeries and other procedures won't have to be postponed in the future if we meet a rapid rise in demand like we did during the pandemic. COVID-19 has taught us many things about our healthcare system, and we know that our pandemic response will lead us to future changes in the future that will support a stronger healthcare system in Alberta. Our system will be different when we're done this pandemic as it was in the beginning, and those will be positive changes. This announcement is exciting for AHS, for the patients that we serve, and for those of us who work at the bedside. This ICU increase in beds will help us provide on an ongoing basis the excellent and timely care that Albertans need. Thank you.
Yeah. Thank you. At this time, we will be taking some questions, and I would like to acknowledge Mayor Blaine Higgin for coming out today to be with us for this announcement. But if there's any questions for the minister or Dr. Lowe, we'll take those at this time.
Thank you. We'll go into the room first. Go ahead.
Hello, my name's Eloise. I'm with Global News. This is a question for Minister Copping, please. I was just wondering if you could go into some of the specifics with expanding ICU beds, what that will mean in terms of construction. As well, I know you mentioned it's focused here in Lethbridge for the South Zone. Will there be added capacity elsewhere in the South Zone?
So thanks very much for the questions. We're still actually working through the plan. There will be 50 new beds. They'll be spread out through the province. We've asked AHS to come where the best places for it. We know that they're going to be in the South Zone, and Lethbridge is the key component of it, so we know that. Part of the plan will be is where the best distribution. So we haven't worked out, where there'll be other places in the South Zone other than Lethbridge at this point in time, but we expect that over the next few months. I can say, and I had an opportunity when I spoke earlier that I actually toured the hospital here and actually saw not only that the ICU, but the surge ICU, the spaces that they had right here. So I'm hopeful we'll be able to get that up and running very quickly, but it may require some capital, but we're working through that right now. The important part of this is we've actually dedicated the funding for the $100 million a year on the operating side, and if we're going to require some capital to make some tweaks, changes here, we'll make sure that we'll deliver that as well.
Thank you. And do you have a follow-up?
Yes, please. I was hoping you might be able to address the doctor shortage that we're experiencing here in Lethbridge and how the budget may assist with that.
Yeah. No. Thanks so much for the question. We know that there's an issue here in Lethbridge. A shortage of family physicians. I've been working Alberta Health was working very closely with Alberta Health Services. Your fantastic MLA Newdorf, is actually, I've been down here, now this is my third time since I've been Minister of Health, and each time we're here we're talking about this issue. Some progress is being made. AHS is stepping in to help out on the primary care side in terms of sponsoring international medical graduates. My understanding that 2 offers have been made. There's been approximately 20 interviews that have been done, and those are going apace. We've also, through PCNs, have funded a nurse practitioner to be able to provide services. So we are very much aware of the challenges. Progress is being made. It takes time. But again, this is an issue not only for Lethbridge and for rural Alberta generally. This is an issue that we're seeing across the country. And our most recent budget, you may have heard me talk before last year about $90 million being provided for rural care physicians in last year's budget. We've renewed that in this year's budget. So that $90 million is in the budget. In addition, I was actually pleased to make an announcement about the Reside program. Now, this was targeting those smaller areas with even more acute care, believe it or not, than Lethbridge, in very small communities, but targeting medical grads who are coming in to do their residency, but paying for some of their the tuition costs from university, and then they are making the commitment that they're going to spend a period of time, 3 to 5 years, in a rural community to be able to have them do to relocate there and work there for a period of time, and then hopefully settle there. And I'm really looking forward. At the end of this month, we have a committee that is doctors that are looking at how effective is our programs now and how can we make them more effective, because this is going to be, quite frankly, workforce is a #1 issue, not only in Alberta, but across the country and in some specialties worldwide. And this is going to be my whole focus with EMS and ensuring we build capacity generally within our system, because how can we deliver the services if we don't have the workforce? So that's going to be a key focus. And we have the additional $90 million, and we're looking at more ways to be able to support that over the coming months.
Thank you very much, Minister. I think we have one more question here in the room.
My question is for Minister Copping. I'm Carson with CTV News. Talking about the doctor shortage, can you maybe just go in depth with what the process has been like so far? I know last week we were talking with MLA Newdorf, and he said that 2 physicians have already been hired. So can you maybe just go in depth with the process of attracting more physicians to Lethbridge, to the South Zone, as well as just to all of Alberta?
Yeah. So as indicated, we're actually looking at attracting international graduates here. As AHS is sponsoring them. There's been, my understanding is over 20 interviews, and we continue to do this work. Also, we are actually looking at and having conversations with our graduate program, like our own medical programs at U of C and U of A. Part of the work that we're doing that's come out of this capacity review, and it's not just doctors, but it's all healthcare professionals, is a commitment as part of our budget to targeted funding into our university system for professions where there's shortage. That includes the medical profession. So I'm actually working right now in terms of how do we move those dollars with Minister Shandro at Minister Madu at Labor and Immigration, and Minister Nicolaides at Advanced Education, because that's another piece. So it's not only about attracting people from around the world who want to come to Alberta and want to come to rural Alberta, quite frankly, and then getting them accredited as quickly as possible, but also training Albertans and training, quite frankly, people from rural Alberta. We already have programs in place which actually prioritize people from rural areas so they go back to rural areas, but how can we improve that? And there'll be more funding in terms of healthcare professions. So all that's on the table, and that's part of this year's budget.
And then do you have a follow-up? Okay. Operator, we'll go to the first caller. Please open the line.
Dean Bennett, Canadian Press.
Oh, thanks. Good morning, Minister. Sorry, I got to front end load these questions. Can you just be more specific in terms of what this money is going for? So, for example, if you're building more acute care beds, where does the $100 million go? Is it primarily for staffing? Is this just about buying a bed and then the supporting equipment? Are we talking about actual capital additions to hospitals? Can you, again, just broadly speaking, where is this money going specifically?
So this funding is on the expense side, primarily, we estimate a cost of an ICU bed of $1 to $2 million per bed per year. So we've actually done our budget. We budgeted on the high side for the additional 50 beds. We do know that AHS has actually been able to ramp up in terms of capacity, in terms of equipment and actual beds. We bought those, and we have much of the equipment that we need for these 50 beds because we actually ramped up to provide it. We may need more. We've asked, we will provide the capital that is required and maybe some slight renovations that maybe need to be done, but we'll provide that on the capital side. But the $100 million is on the expense side. But maybe Dr. Lowe, if you want to comment further on this.
So predominantly healthcare dollars are staffing, and this is predominantly what this money will mostly go to. There are some capital expenses, but predominantly, to answer the question, is nursing staff. To man one ICU bed or to woman one ICU bed, there's a number of staff that are obviously required, and so it's predominantly will be staffing.
Thank you very much. Dean, do you have a follow-up?
Yes, I do. Trying to understand sorry, the question went right out of my head. Minister, have you considered, again, I haven't gone through the EY report, but have you considered other options? So, for example, as I recall, this COVID thing is kind of it's a very rare situation that we get the EU or the ICUs so jammed up. So maybe we already have enough ICU beds, or maybe we need just a few more, but maybe the solution might be to train more existing staff or to create other options to be able to quickly redeploy staff for such unique situations as COVID, rather than spending a lot of money on 50 ICU beds. Have you considered that, and why is this the best option?
So we have considered that. When we took a look at our baseline and we did a benchmark comparison against other provinces, we were the lowest. So part of this is actually to bring us in line with BC by adding the 50. But part of this plan is not only to have these 50 readily available in staff, but also what we've asked AHS to do is, okay, if you don't need them, because again, the ICU demands fluctuate over time. There's periods of times where we're actually going to hit that 173 or even go over it slightly. There are periods of time where it's below that 173. So the other thing we've asked on this is that even though the funding is there to be able to do that, but recognize that if we don't actually need those beds, even though they're open and they're ready and they're available, but the staff attached to them aren't needed, then can we have a more flexible system where we can assign those staffs and can quickly move them around? Because the other issue that we are focused on this year, and you've heard the Premier talk about this, building capacity, is surgical capacity. How do we increase our surgical capacity? We have a backlog of surgeries that we had even before COVID, and COVID hasn't helped because we've had to reduce some of our and postpone our surgical procedures. So how can we use that staff not only be ready to go in the ICU at a moment's notice, but also when we actually don't need them, that we can prioritize in terms of getting surgeries done. So that's going to be part of the plan. But what we've learned from this is that we need a base that we can expand from quickly. We're adding to that base, which is going to be the 173. Now adding the 50. But also what we're asking for is flexibility with our staff, so we can actually have the ICUs ready and available. But when they're actually not needed at that particular point in time, be able to use that staff in other areas, such as catching up on surgeries.
Thank you very much, Minister. Operator, can you let the next caller through?
Amber Goslin, Western Standard.
Thanks for taking my call. This is a question for the minister. Why wasn't ICU capacity increased sooner during the pandemic?
Sorry, I missed that. Can you repeat that again?
Why wasn't ICU capacity increased sooner during the pandemic?
So when the pandemic hit, we had our typical 173 ICU beds, and then we actually built as we went through the various waves, we increased surge capacity to be able to address it. And and I want to thank AHS for actually doing that. We were successful in building the capacity in during the fourth wave, which actually hit our ICU the hardest, and then during the fifth wave, which hit our non-ICU beds the hardest. And we still had we did have to go over capacity at 173. One of the challenges in terms of building capacity is a big part of it is not just beds and physical space and equipment, but the biggest part of it, as mentioned by Dr. Lowe already, is the people. And we have gone through 5 waves during COVID, and this has taken a toll on people. Staff have worked incredibly hard. They have been very tired. So you've had impact in terms of ability for them to surge up to be able to do this, which actually limited our ability to be able to surge, even though we were able to, but it made it tougher to do. Now the purpose of this really, of increasing it on a permanent basis, is to ensure that, and as much as I'd hate to say this, we need to normalize this. We need to have the resources in place so our healthcare professionals aren't feeling that they're having to do a high dive every time we get hit with a wave of COVID or whatever the healthcare issue of the day is going to be. We need to have the staff in place who are well prepared to be able to do this and be able to react quickly on an ongoing basis. And so that's what these 50 beds are designed to do. And quite frankly, when the Premier appointed me as the Minister, that was one of my key priorities in terms of building capacity within our system and permanent capacity, particularly within our ICU system, to be able to respond better to that.
Thank you very much, Minister. Amber, did you have a follow-up?
Yes, I do. For the minister, 50 beds still keeps Alberta well under what 4 U.S. states like Alabama have with a similar population. They have about 1,500 ICU beds. Why does Alberta have so few ICU beds?
Yeah, so when we look at the comparison of across provinces, at 173, we are the lowest in terms of ICU beds, which is why we're seeing an expansion of this. If we actually look at non-ICU, we are actually in the middle of the pack in terms of the comparison. And part of this is always a challenge. At the end of the day, you want to have as much capacity as you need with the ability to surge. But the more capacity you build that if not unused and you don't have flexibility to use those resources elsewhere, then that increases the cost. Now, we did this work with EY to assess where are we short in capacity based on our experience through COVID and in comparison to other provinces. It was determined that ICU is the area of critical concern, and that's where we are lower than our comparators. That we build the capacity here, but we make sure that it's flexible, so that we can actually not only ensure that we can have those extra 50 beds ready to go at a moment's notice, but with those additional resources when they're not needed, we can apply them elsewhere to actually focus on other priorities like surgeries.
Thank you very much, Minister. We have time for 2 more questions. Operator, can you let the next caller through?
Ashley Joanno, Post Media Edmonton.
Hi, good morning. I think everyone has done a pretty clear job of articulating why it's important to have staff for these beds and not just pay for the physical beds. I'm hoping the minister can quantify for me exactly how big of a hole we're in terms of staffing. Can you tell me what Alberta's current staffing level is compared to baseline prior to the pandemic?
Yeah, so I don't have the exact numbers in terms of the workforce. Like I do know, and we can get that to you later. What I do know is that we actually, in AHS, we have been hiring. We actually have more nurses working today than ever in the history of the province. We have more doctors in Alberta than ever, and we still have doctors coming in. We have a positive inflow of doctors, but there is increased demand, and so this is, and so our challenge is, through immigration and hiring, training and cross-training, to be able to use the resources that we have today. Now, in terms of the exact numbers and comparison, I don't have them, but our focus and my focus, and part of this is, the EY report is not only do we need 50 ICU beds, but we need to do more planning in terms of workforce development. We are working on that, and as I indicated before, our budget also includes a recognition that where there is areas of shortage, particularly in healthcare, we're going to do targeted funding into our post-secondaries, and then we're continue to use our immigration program, and I was pleased that the rural renewal immigration stream was announced a number of weeks ago, and that's focused on bringing areas where there's shortages and professions, including healthcare, to be able to speed up that process. And then people who want to come from around the world, come live and work in rural Alberta, including healthcare professionals, can come here. And that's going to be part of our strategy going forward.
Thank you very much, Minister. Ashley, do you have a follow-up?
Yeah, I'm wondering if you could just tell me, I know that this is attracting staff is something that provinces across the country are dealing with. What are the biggest hurdles that Alberta specifically is facing, and how much is your ability to attract people impacted by the lack of a contract with doctors?
Yeah. So in terms of our ability to attract the contract, I'm not hearing that. You know, when we take a look at our pay, and we compare it to pay for doctors around the country, where we have some of the most competitive pay in comparison. But we do understand that we need to provide more certainty for doctors. So I'm really pleased that the AMA and Alberta Health are engaged in a interest-based bargaining process, which is ongoing right now, and really because we are the system. The doctors, Alberta Health, AHS, all the nurses and the healthcare practitioners. We are the healthcare system. We need to work together, and we have so many shared interests in terms of delivering a sustainable healthcare system with tremendous service to Albertans. Because everyone who's involved in this space, the reason they're in this space because they care about Albertans and they want to provide the best healthcare. So I'm very pleased that we're going through that bargaining process. And then our focus is going to be increasing supply, which is again through our own post-secondary institutions, and then leveraging our immigration programs.
Thank you, Minister. We have time for one more question. Operator, can you please open the line?
Catherine Krukowski, Alberta Today.
Well, thanks for taking my question. So on this flexibility of staff, I know one of the challenges in increasing capacity was you were pulling psychiatric nurses who had never worked in ICUs to the ICU staff. Can you explain whether the ICU trained staff will need training in other areas, or if it's pretty compatible with surgical? Can you explain the operational, how that flexibility will work?
So I'll start, and then I'll ask Dr. Lowe to weigh in. But this is something that's not new. We're designating that we're asking for flexibility here, so we move back and forth. But this was done to actually respond, particularly during the fourth and fifth waves. When we needed more ICU nurses, for example, and so surgical nurses, which have the closest amount of training to ICU nurses, were then pulled in, and they were backfilled based on the cross-training and retraining programs were put in place. And so we were able to actually provide the services that we needed in the fourth wave and the fifth wave through those types of approaches. But now what we're doing is taking a step back and saying, okay, what are the, do we need to relook at our training programs, as AHS is doing? How much cross-training can we do, in the system? How is that going to work? What is the base training that we want graduates who are coming out of the system to do, to be able to come in, for us to be able to be more flexible and more nimble. But Dr. Lowe, maybe you can comment further on this.
So, I just want to express again gratitude to our staff. We really, over the course of the pandemic, were able to bring nurses who had never worked in ICU, and they were a great assistance. And so, with the managers and other people that worked in ICU, we're able to bring those people in, and that was excellent. This funding, we will do our best, as the minister have said, to use it as best as we can. It won't go to waste. So if we can think of ways that we can use this funding to help us in other ways when an ICU bed is not necessary, in flexible ways, then we're going to do that. That's tricky, right? But that's the job of AHS and our leaders and managers, to do the best we can to take this funding and make it as good as it can be for Alberta patients, not just when ICU beds are needed, but also when we have other care. And that does involve some cross-training and flexibility and things that will be needed when they're needed. So,
Thank you very much, Dr. Lowe and Minister. Catherine, do you have a follow-up?
Yeah. So the pre-pandemic EY report talked about how hospitals are the most expensive way to deliver care. But I see this newest report. It speaks to the need to expand ICU capacity because we're expecting to get hit by more surges of COVID in perpetuity. We still have the opioid crisis and drug addiction crisis, mental health crisis. Can you speak a little bit on that line? Why is it necessary to expand the baseline? Why is it, as opposed to, I guess, finding efficiencies in the system? And why is it important to bring Alberta's ICU capacity up in line with other provinces?
Yeah. So what we learned through the pandemic is that our capacity is lower in comparison to other jurisdictions. And that we ran a real little risk, even though our system was able to respond to the pandemic and increase the ICU beds so that we never had to ship anyone out of the province, and we could provide great care during the pandemic. It was challenging to do. It was very hard to do. It took a toll on our staff, and it took a toll, quite frankly, on people waiting for surgeries, and they had to be postponed. So it was a recognition, by EY that, and it's also by our government, which is why we asked them to do the analysis, that we need more capacity that needs to be baked into the system. Yes, in an ideal world, we have flexibility with that, so we're not spending money that we don't otherwise need to spend. But the reality is, we need that capacity to be able to protect against future health impacts, and so but it doesn't take away from the need for us to continue to provide, use our healthcare dollars as efficiently as possible. There is if you look at the demographics, the demand is just going to continue to increase, and as a result of that, we need to be as efficient as possible, because we spent nearly almost 40% of our budget right now is on healthcare. So quite frankly, we need to do both. So this was a recognition that we didn't have enough capacity within our system of ICU to be able to respond to health challenges in the future. So we are actually building that. But we also need to continue is, how do we actually be more efficient with our dollars? If you take a look at our cost per population in comparison to other provinces, we were, quite frankly, one of the highest. Now, if you look over the last 3 years, that number has been coming down. And that's been coming down quite frankly due to the great work of AHS and healthcare professionals of saying, how can we deliver better service, right, but manage our costs at the same time? Because it's not about just cost cutting. It's not about reducing our healthcare budget. It is about finding efficiency so we can take that money and reinvest it back in the healthcare, because there's increasing demand, and quite frankly, Albertans deserve to get the best healthcare that we can make available to them. So that is our focus. I don't see an inconsistency between the EY saying an additional 50 is the right number, which is an added cost, and we're adding $100 million to it. But also with the fact that, overall in a $22 billion budget, we need to continue to focus on efficiency so we can reinvest back into our healthcare system.
Thank you very much, Minister. That's our time for today. Thank you to everyone who participated. Have a wonderful day.
Thanks, everyone. Have a great day.